everybody. I hope you're hearing me well. And welcome back to our second edition of Ask the Expert Live. And today we're having a special edition of Ask the Expert. It's our symposium highlights and Q&A. Many of you joined us for our symposium on Sunday, November 1, our virtual Lupus Symposium. And we were really excited about the interest in the symposium and some of the topics that we covered. We had over 600 people on our Zoom call. Those are the ones who registered, and we had a few more hundred on Facebook and YouTube. So we realized there were a lot of questions, there were a lot of interest in some of the things that we were talking about. And so we thought this would be a nice opportunity to make our next episode of Ask the Expert Live all about talking about some highlights of the symposium and asking your questions. Some of you didn't get your questions answered live. So here's your opportunity. So we're going to invite you to, some of you sent in your questions ahead of the session today. Thank you. And we do have a few from the live meeting. And we want to invite you, if you have more questions, to just put them here in the chat, and we'll be looking out for those and see if we can enter that. I say we, because I'm hoping in a few minutes to be joined by my colleague, former president of Lupus Foundation of Jamaica, Dr. Stacy Davis, well known to many of you. So I hope she'll be joining me a little bit later as we talk together about some of the highlights from the session and also answer your questions together. Many of our presenters have been sending feedback in between and giving us some of the highlights and advice that we can use to respond to you. All right, so if we get a few cameos, that would be great. But for now, we can talk a little bit. So back to the future. Embracing new normals in lupus management, research, and life. So as you know, we really aimed with this symposium to really get down to some of the nitty-gritty in terms of so many questions, so many issues as it relates to our current situation in the COVID-19 pandemic. And that's really something that's affected all of us, but especially those of us in the lupus community, those of you as patients, we're feeling that concern, and we've been feeling the same thing from our health practitioners. So we hope that we were able to talk about some of the issues that had to do with COVID-19. And we had some special guests. And I think one of our very special guests was Professor Roberto Caruccio, who talked to us about COVID-19 and lupus. We had so many questions and we got so many of them answered. So one of the things that really interested me as far as a take home for me personally and to share with my patients were some interesting findings. First of all, we talked about the fact that we have measures that we have found to be effective for protecting us against COVID-19, and mask wearing and social distancing do work. So we saw some statistics in Pennsylvania and comparing with Jamaica statistics, and we could see the correlation between implementing these distancing protocols and actually reducing the transmission. So that was reassuring that we're not putting up with inconvenience for nothing. We've seen some benefit, and we also heard some important things. We know that there are vulnerable populations when it comes to COVID-19. And we talked about the older age group having hypertension, diabetes, being overweight, and being over 65 in terms of not just getting the infection, but also having a more serious form of the infection. Okay, so there was a lot of curiosity as to whether are lupus patients at higher risk of getting COVID-19 than other people. And we think about the disease, we think about the fact that, our immune systems, if you have lupus, don't work the way they should. And then some of the medicines are also impairing the way we respond in terms of an infection. So we were actually quite reassured that given the early statistics, we were not seeing a higher level of COVID-19 infection among lupus patients than among the general population. So that was really, for me, very reassuring. There was also the question about if we do get COVID-19 and you have lupus, are you at risk to have a worse outcome than other people? And one of those questions that was also answered, because the growing cohorts or bodies of data are not showing that lupus by itself is increasing your risk of doing badly if you get COVID-19. But if you have any of the other comorbidities associated, so we're talking about the things I mentioned, overweight, diabetic, that's type 2 diabetes, and high blood pressure, being older, then those would also apply. So we know many of us do have these issues, and so we're aware that we have that similar risk with the rest. But having lupus does not inherently mean that you're going to have a worse outcome than if you didn't have lupus. That was reassuring for me. So there was also this question of what should we do with our medications if we, while the COVID epidemic is happening, COVID pandemic, should we be off them? Should we be on them? Are they safe? And again, we were reassured that based on the data, the medications that were generally used for treating lupus did not put you at a higher risk of getting either more infection, of making infection more likely, or having a worse outcome when it came to COVID-19. And that was good. And so the recommendation is that the best place to be is for your lupus to be well controlled. So that's your best bet for a good outcome. So on an everyday basis, we should actually be continuing our lupus medications in pretty much all categories, including hydroxychloroquine, including what we call the general immunosuppressives, and including the biologics. It was generally felt that they should all be continued when it comes to persons with rheumatic conditions, including lupus. But if we were to get an infection, some of them would be temporarily held for a week or two to ensure that we are getting over the infection and so on, which is not usually a problem. Okay, so that answered a lot of my questions. I hope that answered a lot of questions for you. There was something else that I found interesting in Professor Caricchio's talk. And one of those is about the medications that are being used to treat COVID-19, and why do they resemble some of the medications that are used for rheumatic diseases such as lupus. And we found it very interesting to learn that COVID-19 infection actually induces something like an autoimmune state in many people. And that may be why they very, very often get extremely ill, is because it triggers the immune system, and the immune system gets out of control. And so we're having this intense inflammation that could be in almost any organ, the heart, the lungs, even the skin, and the kidneys and so on. And then this is what causes some of the persons to have a bad outcome. So actually interesting to note that intervening in a timely manner with medications that are similar to some of the ones that we use for controlling autoimmune conditions is helping to save lives in COVID-19. And this is in people who don't naturally have an autoimmune disease, but by getting COVID-19, it triggers a reaction that's similar to that. And so they've been able to use things like dexamethasone, which is a steroid. We have anticoagulation because some people get predisposed to clotting. Many of you know that some lupus patients are predisposed to clotting because of certain antibodies. And a similar thing appears to happen in COVID-19. So using blood thinners at the right time and using biologic agents like remdesivir seem to be helpful and are helping people with COVID-19. And so the number of persons who are dying from COVID-19 is actually less now because we're better at dealing with it than we had been. And some of the same medicines used for lupus are some of our tools in that area. Okay, so that was a highlight for me. I don't know, let us check the chat and see if there's anything fresh in the chat as it relates to this area. Okay, so, all right, so I'm looking at some of our questions. Let me ask Rochelle. Rochelle, do we have anything in the live Facebook chat at the moment? Let me just look. And all right, so okay, nothing coming in yet. And I'm happy to welcome, I see Mrs. Marsha Thomas Norman has come in and she's doing a little cameo for us. I'm really happy to see her because she was one of our, yes, you're one of the speakers in our second half, which was really exciting for a lot of people. As we really got some tools, and not only people with lupus, but I think everybody got some tools in terms of how to think about going forward. You know, we talked about the way forward when it comes to lupus, and you know, a lot of us felt stumped dealing with our patients or personally or with our friends, family members in terms of what can we do? The world is looking so different compared to what it was, and how do we navigate? So, Mrs. Thomas Norman, may I call you Marsha? Right? Maybe you can share with, and please call me Desiree, you can share with us some highlights of things that maybe some take-home points, because we really found your presentation interesting, and I want to invite everybody to visit our YouTube page, because if you follow and you select that thing notification, you'll know when there's new content, and the symposium is already up there, and you can actually find that full presentation done by Marsha, by Mrs. Thomas Norman. So, but I wanted to just share with you some insights, some thoughts, what's on your mind as far as the situation and what we should do to navigate well.
Well, thanks for the invitation and commendations again for the event. It was quite useful. I think what I want to share with persons is the idea of not giving up, especially where an income is concerned. I know that during this time it has caused a lot of, how would I term it, mental stress on persons, and even persons who are working are receiving reduced funds. So, and the bills are not reduced. People still have to pay their mortgage or their rent. Light bill for some persons have doubled, especially if they have kids at home. So one of the things I encourage persons to do is to keep calm if possible. If we feel that the pressure is overwhelming, we need to reach out to someone to talk it through. And what we had shared on Sunday was that there are some practical things we can do in order to enhance our income. And we spoke about three main things. We could have a physical online business. Well, no, physical business, not online. And we gave examples that persons are doing private tutoring if they have enough space at home. and they feel that it's safe enough and they are observing the COVID protocols. Persons are doing private tutoring. So if you perhaps can't do that full time, persons are doing, suppose you're good at math, you're good at history, things like that, whatever is your niche. I know a lot of persons do remedial classes, especially for math or the sciences. They want the children to catch up, as they say, or the practical subjects like art and craft, home economics.
Mm-hmm.
It's some of those subjects you doing them online. It's a bit impractical. Well, I think
Yes.
so. But one day I came home to find my daughter in PE gear with PE. So that was very amusing. I was like, okay, you're still doing
Okay,
PE.
nice.
Yeah.
It goes
So
to
I
show you.
actually I found a way even to do swimming. I'm like, okay, man.
Yes.
So things like that. I know people who cook well. I've
Yes.
seen a rise in their income because, and you can try it out. Suppose you bake well, you can perhaps do small samples, see how it goes, and then go for it, charge something. So I think it's niche marketing. Some people focus on breakfast or simply porridge. Some people are doing cakes, puddings, things like that. So whatever you're good at. I don't
Yes.
particularly want to go to the hairdresser, but my hairdresser is willing to come to my home. So
Yes. There you go.
people,
So that's, I mean, those are some really nice ideas. I mean, we talked about, and the good thing is Dr. Davis has joined us. So that's, I mean, we were on together in the same session. So
Hi
Dr.
everyone.
Davis,
Evening. Evening everyone.
I see you're busy at the office, hard at work.
Yeah,
So am I. Thanks for taking a
I
few
can
minutes.
imagine. Yeah, sure.
Yes, isn't it great that Mrs. Thomas Norman
Marsha can do
Marshall.
this.
By the way, I hope nobody minds, and it wasn't by design that we are queens. We are all
Yeah.
three of us, old girls in school. Isn't that a coincidence? And Marcia, you were just telling us, you know, the rule number one is not to panic, right? And to
Yes,
just think things through, because there are solutions out there.
I think
And I was
so.
really, yeah, I really, Stacy, any thoughts? I mean, I heard Miss Beeson, Damily Beeson, sharing about actual grants to start businesses from Path. I thought that was quite interesting. It was not
Yes, yeah.
a feature that I
Aware.
was aware of.
Mhm. Right.
Yes. So
Mm-hmm.
there are really a lot of opportunities out there that if we look for them, we can have a way forward, right? So over to you,
Yeah.
Stacy.
Wait, pardon what you said?
Over to you. I want you to, you know, carry on this conversation a little bit. I know that some of the biggest, hottest interest was in that panel discussion, talking about the
Yes.
way forward.
Mm-hmm.
Marsha was on with us, and you may have had some highlights too. That other highlights that
Right.
you wanted to share.
I found one of the useful things Miss Beeson brought up though was that thing about trying to share expenses where you can. Because I think, you know, right now we're in a country where everybody's driving to wherever they're going. Maybe they can even, you know, carpool if people are going in the same direction and live close by. And
Yes.
even find other ways to minimize the expenses was an important one because we know whatever aid is out there sometimes is going to run out sooner or later. You know, this is a small society, we can only offer so much. She also brought up the thing about NIS grants too. And she talked about, you know, if
Yes.
you have a passing of a loved one, remember the funeral grants that are out there.
Yes.
Um, I know, I think it was Mrs. Norman who mentioned the whole thing about websites too, to look for opportunities on websites online. She brought my attention to, I think, Caribbean Jobs, it's called, Mrs. Norman. Are you there?
Yes, Caribbean jobs. Yes.
Yeah. So that was a more of a local, looking at more local opportunities. And then, of course, you have the more international, broader ones like the Craigslist. So you have to do a lot of due diligence, but
Yes.
there are opportunities there. I think it's important when the financial stress is coming on us, to remember our mental health always.
Yes,
So
yes.
I found the fact that there was a helpline through the Ministry of Health that can, you can reach out if you really feel you're being overwhelmed. But the fact that, a positive outlook helps you through all difficult times. It's hard to be positive when you're going through a terrible time, but try to be positive.
Yes.
Look for that one positive in each day, or think about the
Yes.
people who support you in life. Or if you're a spiritual person, turn to God for a little more support in a hard time, because he tells us he will walk with us wherever we're going.
Yes.
And then, I think it's really about, a lot of it is resilience, adapting to a major change and realizing that, you have to make it through, and you can make it through, but it will take time. And you shouldn't be too hard on yourself sometimes when you feel overwhelmed, because I think we are all feeling overwhelmed at this time.
Definitely. There are times that we all need, yes.
Even those of us who are medically trained, we're overwhelmed.
Yes, yes.
So everybody, and so you shouldn't feel disappointed in yourself if you feel like you're having a hard time.
Yes, yes.
It's day by day. It's really day by day at this point.
Very much so, very much so. And I found those resources really helpful. And once again, we're going to invite people who may have missed Mrs. Thomas Norman's talk with all those ideas. Please visit our YouTube so that you can actually get to review, watch, and she had slides up. You can take notes, screenshot some of those, and get some great ideas. I heard her talking about the online, and a friend of mine told me once about her grandson who learned to sew online, and it really turned out to be a fun thing that he was really good at. So there are all kinds of things that's practical or hands-on or otherwise that can be done. I think that's really a good positive way forward. I wanted to talk a little bit of, just as we had one or two questions that came up in that segment, Dr. Davis, and one of the questions was this. This person, let me just kind of go back to that, was relating the fact that if you're in an office, we're talking about workplace safety. And she talked about being in an office where they wanted to do some occupational health sort of interventions to kind of reduce risk. And she wanted these to be implemented, but the question was whether it was cost effective or not. And the others didn't seem to think it was important, but of course she was more concerned. She said she had lupus, and so she wanted to know, like, what could be done. Is there a legal recourse, or what should be done in a situation like that? I want maybe your thoughts. I put that question to Dr. Duncan.
Right?
Yes.
But from what I gathered from our panelists, one being an occupational and safety specialist, and the other one being a legal representative with the ministry at some point in her career, was that it really comes down to negotiating. There is no promise, because there's this concept of reasonable accommodation where your employee should provide you certain protections to an extent that is deemed reasonable. So not too expensive. And when we asked who decides what's reasonable, the focus was really on negotiating, sitting and just discussing how each party can meet each other halfway.
Right.
If the person really feels that this is something that is averse to their well-being, they may have to go and then seek some assistance to see how to remedy it through, say, Ministry of Health, or get a legal representation. But that should really be the last resort. Last resort,
yeah. Yes, because in the end, the business has to stay open for you to have a job. So, yeah, I got that too. I got that putting the question also to Dr. Duncan the course of the day. She was really emphasizing, as you did, that negotiation is really key. Talking about your concerns and seeing what can be done on a case-by-case basis. And it's usually a very effective way to go forward. versus a confrontational approach. And then, of course, as we've just heard from Marshall, that if you feel like your setting is not, you know, the best for you, you can also explore. That one mustn't be afraid to explore other options and opportunities, and so on. So that just came to mind. So I thought that was also relevant. Dr. Davis, as our time is spent, although Rochelle tells me that she budgeted a little bit of extra time, we usually end at 6:30 sharp, but she told me she budgeted a little extra time because of the topic. Okay. But a few questions came in about hydroxychloroquine.
I thought the expert on that would answer that. Where's Dr. McGee?
Yes, okay, yes. Dr. McGee's been busy, but I actually had a chance to to look at some of her papers on that. And isn't it amazing that, you know, one of our colleagues was really at the forefront of the early work and some of the really most revealing work about hydroxychloroquine in the heart and its safety. So I found that really interesting. And it was reassuring take-home message that it is safe to continue the hydroxychloroquine. But we know what the concerns were because, of course, you know, lupus patients all over experienced shortages because there was this hope that hydroxychloroquine would be used to treat COVID-19. And of course, we all know that that did not turn out to be an effective treatment for COVID-19. So it's not being recommended at all for that. And in the course of the discussion, persons started to bring up concerns about how it would affect persons' hearts and so on. And so our old lupus patients naturally start to wonder, is it safe for their heart? And should they be taking it at all? And, you know, so I found it good that we actually had data about the safety of hydroxychloroquine and that, you know, there was these protective effects of the heart when it comes to hydroxychloroquine in this wonderful cohort study done with Dr. McGee, Dr. Tuma, who was also a guest presenter last year. And we found that the conduction abnormalities were slightly higher, but not excluding the general population, and that people on hydroxychloroquine actually did better in terms of heart health over time when it came to lupus. These are lupus patients, you know, for a number of reasons. And so that was really reassuring for us that our patients can continue to take their hydroxychloroquine and not really worry. You know, a question came up, you know, from one of the doctors, Stacy, as to whether you need to do routine cardiac monitoring in lupus patients who are on hydroxychloroquine. Do you have any comments on that?
I don't know of any such recommendation, and I would assume that given the data that was presented, that would not be necessary.
Right. That's well, let's put it this way. What we know is that lupus patients should have heart screening, but not because of hydroxychloroquine, but because of the disease itself. Yes. That we need to make sure that, you know, any risk factors, other risk factors, that the lupus is well controlled, and any other risk factors like cholesterol problems, hypertension, any other things are strongly, aggressively addressed, and that we have a low threshold to do the standard sort of heart screening. And we may actually start a little bit earlier than the general population, but not because of hydroxychloroquine, actually probably the opposite. So yeah, we don't have a special screening or special tests that need to be done when you're on hydroxychloroquine, because that has not been shown to be necessary. But in general, as lupus patients, we should be conscious about our heart health. Some of us are afraid to take statins, Stacy.
I'll leave that one for you, Desiree.
We really have to protect our hearts. You know, it's all about looking at the benefits, and the benefits are clear. So we really have to remember that from the heart standpoint, as a lupus patient, you are higher risk than the general population. So you really want to do whatever you can, keep that risk as low as possible, and to just, thrive, not just survive, but thrive, even though you have lupus. So I thought those are some good, interesting highlights. Here's another question that came up. So let's see if I can find my my question slide here, my question section. Okay, so we did that one. And so some of these are actually talked about in the course. And one doctor, yes, so that we talked about that. Okay, so here's a question about it related to the talk that Professor Eisenberg did. Was that a great talk, Stacy?
Yes, very much so. Very much so.
Anything that stood out for you in that talk? Any take-home messages that you kind of stood out for you in the course of that one?
I think the promise of rituximab, both in terms of being efficacious, but also being steroid sparing, because we know for lupus patients, a lot of the morbidity, especially for those who have to go on high dose steroids, because high dose steroids are organ sparing and life saving at times, but often comes with side effects, significant ones. And so the opportunity to have something to offer patients that can be steroid sparing and change the course of their disease was really great to hear. Of course, the concern about costs, and we're hoping that the cheaper options will continue to get cheaper and cheaper.
Definitely, definitely.
Because cost, I think, is what is the basic limiting factor in using rituximab more widely.
Yes.
But it was great to have something that, hopefully in the future, the reliance on high dose steroids could be reduced significantly.
Definitely.
And one of the things I liked.
Yes, we had a number of questions that related to that, because one person asked whether you can actually come off steroids. And of course, the resounding answer is yes, yes, and absolutely yes. Not just come off and throw yourself into a flare, but really work with your doctor to introduce a regimen, what we call a steroid sparing, medicines that take over the lupus control. We know that steroids are very helpful in an emergency. We even talked about the COVID-19 patients getting them, but certainly in a flare and in an urgent situation, they're really effective. But of course, part of the objective is to really work with your doctor to bring in some of those other medications that we know cause us not to have to rely on steroids anymore, and to actually try to be off steroids. And we're seeing that, this is really something doable. I've had a lot of positive experiences with the rituximab. I'm going to tell you, so far, it's been really something that's been helpful for a lot of my patients. We couldn't quite get settled. And we know that there's some other agents out there that, may not so far be in Jamaica, but will probably start coming in soon. And isn't it great that rituximab is one of those drugs that is subsidized under the National Health Fund?
Yes, it's actually great.
Yes, definitely. So that's really a wonderful development. And we know there are other ways to get help. I know a couple of my patients, the company actually, in some cases, the company actually donates some of the, like a vial or something. So sometimes you can work with different options. You get your copay. Sometimes the insurance will cover about 80% if you have that, or you can actually apply to government funds, to assist you with the invoice. But a lot of people find it really cost effective, because if they think about actually using this drug that they may not need to redose for 6 months or even sometimes a year, and finding that it actually works out. It seems expensive up front, but it actually works out. And if it prevents you from getting complications because of being on steroids too long, especially with your bone, having to replace a joint or something because of being on steroids too long. Some of you have had that experience. That can be a very expensive complication, right? So that's good. Here was another related question. Somebody asked about what the side effects were of rituximab. And did you have any thoughts or experiences with that, Stacy?
I find most people tolerate it well. What we try to do is that we do what we call pre-medicating our patients. So we anticipate possible reactions, and to prevent those from happening, usually get basic medications, an antihistamine, some Tylenol, a one-time shot of a steroid via drip. And therefore, most people go through the infusion. It's actually something that's administered through an IV, and you have to get it delivered over a few hours. And basically, most people do well. I don't find a lot of people. We do, however, do monitoring with labs to make sure there's nothing wrong. We do, of course, do some screening beforehand. And there's some rare side effects that occur that I don't even know if I should mention, Desiree.
Yes, that's been my experience too. I haven't found anyone having actually a reaction, because as you said, we give the DPH and so on, and Panadol before. And we do check that white blood cell count, because a few people can get a low white blood cell count. It usually comes up, it comes back up if it happened, but it's not very common. Sometimes you can give the person things to bring it up faster, but it usually comes up. So that's one thing that you can be aware of. But generally speaking, my experience is it's been pretty well tolerated. So that's a nice positive for us. And we see like there's so many on the horizon, and we're approaching research better. So we're actually, a lot of the studies were being done, and we couldn't prove that the drug was effective, even though our experience was telling us it was effective. And so we're so glad that we're finding different ways to, with my phone, different ways to identify these medications that are showing so much promise or being actively used. So it's really an exciting time, in the lupus, in this lupus story, the lupus journey, a collective lupus journey. So I found that pretty good.
Yes, definitely.
All right. Any other highlights, Stacey, that you want to mention? I mean, we talked a little bit about, looking at our patients, putting the patients at the center of when we do research. And I think that was a really timely reminder by Dr. Raquel Lowe-Jones. In almost every kind of research there is, even the most scientific, even a drug trial, compared to even, things like what Dr. Reid presented, which is actually asking the patient about their experiences and their concerns, and having the patient help set the agenda, as far as what we need to look into more, or even, what really needs to be addressed. So I found that, a really good reminder. Yes.
Because I think sometimes as clinicians, our focus is a little different from the patients, and it can be read as being insensitive, and it certainly is not done intentionally. And so sometimes it's good to get a reminder from our patients, what they are feeling, what their expectations are.
And what's important for them.
Right, exactly. Yeah.
Awesome. Yes, I remember our guest on last month's Ask the Expert, Dr. Michelle Hamilton. Actually, I always like to quote her on something that she said once, because she is a naturopathic physician. And so she sometimes said that, when it comes to health issues, it's reasonable to do things in different ways. Like it's reasonable to approach focusing on the disease and fighting it and attacking it. But then it's also sometimes appropriate to focus on the person. And so there's a time for everything, basically, is what I took away from her talk once in one of our support groups as well. So there's room to focus on the person as a whole, and to help them to be resilient and to do well, and to meet their goals, and there's room for sort of being serious with this threat to their health, and to doubling down and dealing with it.
Right.
So that's good. Let me see if Marsha is still on the call. Let's see if Marsha. I see her picture, but I'm not hearing her voice right now. So. Oh, here she's unmuted. So Marcia, I was about to put you on the spot because, you know, we were excited about your talk. And I wanted to see if there was anything that stood out for you in the course of the session, maybe in the rest of the panel or in any part of the, or even from the questions or in any part of the program on Sunday.
Well, I tuned in mainly at the start of the panel discussion because I had some other activities doing. But I myself had work at the Ministry of Labor. So the young lady was talking about the benefits path and NIS. I think those are important. Those information is important because sometimes passes not a lot of money, but everything counts. So I think that part is important, especially like death benefits for survivors and so, because everything adds up. And if you know you can get 80,000 here, as I think that was the benefit the last time for NIS death benefit for a relative. So
Yes.
I think that part was very important because if persons are paying taxes and something is due to them, I think we should make use of the opportunity. Don't be shy to say.
Yes, yes. In fact, there's a friend of ours who's a former board member at the foundation, a retirement expert, Mrs. Cooper Denuse, who always says that, reminds us that NIS and NHT are not taxes; they are contributions to our retirement income. So and you know, and they're tied to you know, they're tied to things like inflation and so on. So it's, you know, it's not really a waste of time, and so a lot of us are finding out that there may be benefits that are there that we're not aware of. So that was interesting, that question about whether, you know, lupus is a disability. And did you hear that one? And I thought Miss Beeson handled that quite well, because of course you're not disabled just because you have lupus, but we do know that many people may experience complications of the disease or its treatment that it may actually leave them with a health problem that is long-term and that impairs what they're able to do. And in that case, definitely you should check out to see if you would qualify, because many people do, for income that is reserved for persons with disability for such support. Yes. So I found that, you know, quite helpful. How about the mental health? You alluded to that, Stacy. You know, we were talking about mental health, and as I meant to ask you if you have that hotline. Somebody might be listening that has that hotline, or we can put in the Facebook chat a little later on that Professor Gibson shared with us. And I also want members to remember that as a member, you also have access to counseling, professional counseling. And, you know, we're really thankful for people like Reverend
Nielsen.
Yes, Nielsen Wade.
Yes.
So, you know, who provide that, and that's virtually, you know, you can do your online counseling. So if you're a member and you feel a need, you don't have to be like in a crisis, but you just kind of want to get your health checked from a mental standpoint, just make sure that you're okay, talk to somebody, you know, get in touch with us and let us set up a session for you, right? That's one of the benefits of membership.
Membership, yeah.
Yes. And we heard other things from Mrs. Gemmott, because, you know, we've been having support group meetings. Mrs. Gemmott, of course, is a health professional herself and has been walking the journey with lupus, so she can see things from both sides. And she's also our services director for membership and helps us take care of our members. And we've been having support group meetings every month, you know, between the Western group, the Kingston group, they're online. And you know, that's really meant a lot. We've seen like on the call, Stacy, it's like 40 people, 30, 40 people on the call. So we know that people are finding it really helpful just to check in, you know, and with your people, your group that understand, and just to share and to learn something interesting and helpful. So it's so important for us to all stay connected, isn't it? During times like these. And that's really got to be part of the, you know, as we talk about the way forward. That's really, you know, has to be part of how we move forward together. And yes.
And maintaining relationships in a different way, in a new way.
Yes. Tell me about that. What did you learn about managing relationships in the COVID-19 in a new way? What does the future hold with managing relationships, Stacy?
This may not be direct face-to-face, but once again, you can entertain yourself online. My cousin, we had our 50th birthday online from all of us cousins across the world.
Oh
You just gotta
my.
do it. It was a Zoom call.
Okay.
Those who wanted to bring a drink, brought a drink. You know, it was just still like we were there
Cheers.
celebrating.
Cheers.
Things, you know.
Yes.
Sometimes the tech-savvy person could play games online with their usual social group instead of face-to-face dominoes, you know.
Yes.
Have your Bible study online. Arrange a Zoom meeting. You all meet.
We're adapting. Online. Yes.
Connected.
And yes, and we mix it, because sometimes you have to see each other, and we keep the appropriate distance, and you know, we get the fresh air, and so we have to balance. And we'll do all right, you know, as the song said. And so I think that's a really nice note for us to sort of maybe wrap up this session. Did we see? Let me just make one last check with Rochelle, see if there were any new questions that came into the chat. We kind of highlighted a number of them in the course of the discussion that we had before. So I'm hoping that we touched on everything. And really thanking, as you mentioned, Stacy, when it comes to technology, some of us take to it a little bit easier than others. But wasn't it interesting in the survey to find out that most persons, at least in the respondent group, actually had access to some kind of device, you know, and even if it's not theirs, it's in the family, isn't it?
Right, because that's so important at this time.
Yes, and people were very interested in telehealth. I found that very telling. I thought that was very informative. You know, many people are not sort of comfortable going on the public transport or going out as often, but I found that quite interesting. Are you doing telehealth?
Yeah, I'm doing a mix.
Yes.
So for those who are doing fairly well and don't want to come out, we'll do the telehealth.
Yes.
Yeah. So I mean, it's something for the time.
Yeah.
So
the main thing, as you say, adapting and resilience and being hopeful and being knowledgeable, staying connected, right? And being part of a community, and knowing, as the adage said, we used to have a saying at Lupus Foundation, you are not alone. And that's still really the saying, isn't it? And pity we didn't have that video to play, courtesy of Dr. Wright, to take us out of today's session. I didn't think of it until just now.
Yeah, that would have been nice. It was.
But we can put it up on our Facebook page. We can put it up, and it's probably on our YouTube already, because it's part of the symposium. So if you go to the symposium recording, you go towards the end, you can watch that and listen to Dr. Joel Wright, his inspirational rendition, that you'll never walk alone.
Right. So.
And so, should we take it out with that? Should we call it? We had an extended version of our special post-symposium episode of Ask Expert Live. Remember that we're here every first Wednesday at 6 o'clock. Usually the sessions are very short, from 6 to 6:30 sharp. So we invite you to look out for the announcements, send in your questions early or during the discussion, and listen out for the next installment of Ask the Expert Live. Remember to, if you're not part of our community, just visit our website. It's going to be Lupus Foundation Jamaica, all spelled out, .org. All you have to do is visit our website. and you'll see that you can join, become a member. You don't have to have lupus to be a member. You can volunteer, you can donate. You can buy some of our merchandise. I'm not wearing the merchandise today, but you know, lovely masks and t-shirts and lots of cool messages, really beautiful stuff. You can do that and help us, help support, give a donation, help support Lupus Foundation. Thank you so much for being part of our community. I hope you're following this page, like it, follow it, and you will hear and you will see when there's new content. And we want to really thank RG Productions, in other words, Rochelle Thomas, for making this possible, conceptualizing this new program and taking us out. And and we really want to thank her for everything that she's been done, leading that wonderful social media team of volunteers that have really ramped up the conversation on the social media, since we weren't able to be out there in the same way. And you've just been amazing. You guys have responded. You've made this page active. We've had a lot of fun together throughout Lupus Awareness Month in October. Thank you all for supporting the cause, joining the fight against lupus, sharing all that information, following, liking, and coming to our symposium on Sunday. Let's get the word out. Knowledge about lupus saves lives. So learn all you can, join the fight, and let's join together to fight lupus. Thanks so much, Norsha, Stacy.
All right,
thank you, everybody. Until
Have
next
a good
time.
evening, everyone. Bye-bye.
Blessings to everybody.
When you walk through the storm, hold your head up high, and don't be afraid of the dark. At the end of the storm, there's a golden sky and the sweet silver song of a lark. Walk on through the wind, walk on through the rain, though your dreams be tossed and blown, walk on with hope in your heart, and you'll never walk alone. You'll never walk alone. When you walk through the storm, hold your head up high, and don't be afraid of the dark. At the end of the storm, there's a golden sky and the sweet silver song of